Here's the truth about mandatory Medicaid contracts in Texas. State law requires the Health and Human Services Commission, or HHSC, to award Medicaid contracts to health plans controlled by county governments, no matter how poorly those plans perform in HHSC's evaluations. Since 2016, in procurements for contracts to care for Texas' most vulnerable children and adults, county-controlled health plans finished with the lowest scores. Every single time. But this year, HHSC intends to execute contracts to those health plans, allowing them, not better performing plans with higher scores, to serve aging Texans and people with disabilities. Public health plans claim HHSC evaluations do not measure their ability to perform. That's a serious charge against HHSC's newly reformed procurement process, which the Hospital Plan Association publicly supported just last session. Worse still, the health plans are trying to hold legislators hostage, claiming they need mandatory contracts to draw down federal Medicaid funds. But the reality is there's no connection between a hospital district's ability to access federal dollars for care and HHSC's determination about whether these health plans are qualified to offer that care to the most vulnerable Texans. County-controlled health plans can and should compete for Medicaid contracts. Texas taxpayers and Medicaid members win when every health plan competes on a level playing field. Mandatory contracts aren't competitive, don't serve a public purpose, and aren't Texan. The legislator can get rid of them by passing SB 651 and HB 2401.